we continue to refine the scope of care for COVID-19 patients based on our local experience. We have found that low-risk children between 12 months and 5 years who have been infected with COVID-19 have generally been doing very well, and similar to children above the age of 5 who have been able to recover at home under our primary care directed Protocol 2 framework. So, from the 25th of March, tomorrow, we will allow these low-risk children infected with COVID-19 infection aged from 12 months and older to be managed within our P2PC or Primary Care Directed Protocol 2 framework, extending beyond the current age threshold of 5 years and older. This means they no longer need to be hospitalized by default and may recover at home, supported by family physicians. EC19V has made a recommendation for a second booster dose to be given for persons who are medically susceptible to severe infection. And this helps these higher risk groups to remain adequately protected against a severe COVID-19 infection as we resume normal activities. MOH has accepted these recommendations for the following groups to receive a second booster dose at around 5 months after receiving their first booster dose. And these are persons who are aged above the age of 80, those who live in aged care facilities such as nursing homes, as well as medically vulnerable persons who are at increased risk for severe COVID-19 infection and a poor outcome due to their significant concurrent medical risk factors. These risk factors include chronic diseases of the heart, lung, kidneys, liver, and other organ systems, which will lead to poor function or even a failure of function of these organs. EC19V has also considered whether a second booster dose is needed for healthy persons in younger age groups. These persons have better immune responses to vaccination and are at a lower risk for getting severe disease. Our local data shows that their protection against severe infection has been sustained after their third mRNA vaccination dose, and the degree of vaccine waning over time has not been as great as in the older populations. Their existing immune protection remains sufficient, and this is supported by international data which has yet to provide as clear evidence of benefit for the fourth dose compared to in the older age groups. EC19V therefore has not made any recommendation for them to receive additional vaccination doses after their first booster dose.